11:42, welcome back. It is Medical Monday. Today we are talking about flu and RSV prevention. We're all on your side with some tips to make sure your children, of course, stay healthy all season long, which is why we have Dr. Anne-Marie Toohey here with us today from Secours. Thank you so much for joining us here today.
Yes, my pleasure.
So talk to us about all of this. What are some of the common symptoms of flu in children, and then how do they differ from, say, the common cold? How do you tell the difference?
Sure. So they can be very similar. However, typically with the flu, you get a lot more body aches, higher fevers, like 103, 104.
Okay.
And they can progress down into the lungs, causing secondary infections potentially, like pneumonia or sinus infections, ear infections in kids.
Oh, wow. Goodness. Well, so when should I take my child to the doctor for flu symptoms? I mean, especially if I'm recognizing that it's the flu and not just a common cold of some sort, when should I be triggered to say it's time to get my kid to the professionals?
Sure. So in young infants, we want to be a little bit more cautious because they might present a little differently with more respiratory symptoms earlier on than maybe the rest of us might. But if the fevers have been persistent for more than 4 or 5 days, if they're not drinking enough to be going to the bathroom enough, that is wetting diapers in babies, like less than 4 times a day, or if they're really struggling to breathe, those are reasons to bring them in.
Okay, good advice there.
Yeah.
And how can I prevent my child from getting the flu and then also at the end of the day spreading it to others, because we don't want to infect everybody else around us?
Exactly right. So best prevention is getting your flu shot, and we certainly have flu shots and encourage everybody to get that at this time of the year. Also, for little babies who are not eligible to get the flu vaccine, which is less than 6 months, kind of creating a little cocoon around them, that is having the parents and the siblings get their vaccines, grandparents, anybody around, daycare providers, those kinds of things. Hand washing, of course, is important for spread of all infections, and then really taking care of surfaces and things like that. For older children, or even for younger children too, we do also have antiviral therapy that we can implement to help usually just shorten the course of the illness. It doesn't really make them any less infectious or make it better in the moment, but it at least shortens the course. Yeah.
That is good to know. So then talk to me too, who is eligible for the RSV prevention, and then when should that be given?
So RSV is another respiratory syncytial virus that is common in the same time as the flu and can occur concurrently, but hopefully not at the same time.
Definitely.
But that is really hard on younger children, particularly under 2, where they can again get very bad respiratory symptoms, go into respiratory distress. So we do have some prevention. We have prevention where pregnant mothers between 32 and 36 weeks can receive the vaccine prior to delivery, and that helps to protect their child. But we also have a monoclonal antibody that can be given, and we have in our offices for babies in the first few days to week of life, or up until they're 8 months old, for those kids who maybe were born in the summertime and would still be eligible. That can help basically prevent the infection. Other things similar to flu are, hand washing and washing surfaces and things like that.
And then we're talking about this RSV preventative. I mean, obviously there are pros and cons to everything at the end of the day. I mean, what are some of the risks and on this side of things?
So risks with this injection simply include injection site pain and discomfort. Sometimes there might be an allergic reaction. That is very rare. And it has been around now its 3rd season for the infants. That is the monoclonal antibody, and has shown tremendous efficacy for babies in preventing hospital or clinic-attended illness.
And any potential side effects, too, if you're giving that to a little one or something like that?
So, I mean, we give it to 1- and 2-day-olds who we get really excited about if we have any fevers for those kids. So very minimal side effects.
Excellent.
Just excellent benefit.
Well, it's a very important topic to talk about at this point in time, because it's all going around right now. So, Doc, thank you so much for coming in. We appreciate it tremendously.
Thank you very much.